where CNS is affected, skin affected, hair affected, then it is a case of multiple carboxylase deficiency. Multiple carboxylase deficiency. Here, patients also have tomcat urine odor. Tomcat urine odor, right? Then, if in a disease CNS affected plus hypopigmentation is given, then most probably it is a case of phenylketonuria, right? Then, CNS affected plus burnt sugar like odor, then it is maple syrup urine disease, right? Then, if a question is given, a child with stroke, so a young person with stroke, right? And some skeletal abnormalities like knock knees, pectus carinatum, and elongated limbs, such kind of picture is given, then it is a case of homocysteinuria. Okay, in homocysteinuria, these skeletal abnormalities occur.